This week we'll be talking about hearing impairments. And hearing impairments is considered a low incidence disability, which means it's not as common as some of our other disability areas that we would see in schools. As a special educator, you may or may not have students who have hearing impairments in your classes. Typically, students who have more severe or profound hearing impairments are paired with teachers who have an expertise in that area and who are fluent in American Sign Language or some sort of finger spelling. So for you, if you are teaching in high incidence areas, you may have students who may need an AM/FM device, which means kind of a microphone for them to listen to. You may have students who need preferential seating because they have a cochlear implant, or they may have some sort of hearing impairment that may need specialized seating because of background noise or certain pitches. So if you're going to be working in high incidence areas, you're not going to have a whole lot of students within your caseload who are going to have hearing impairments. If you decide to go down the route where you're going to be working with more low incidence, then working with students with hearing impairments does take a specialization in order to meet the needs of those students, especially because of the communication. In this PowerPoint, we're going to talk about the disability area of hearing impairments. Just looking at the history of the field, the very first school for students with hearing impairments was in 1817, which is really surprising in some ways, considering that we didn't make strides with more cognitive disabilities until really the 1960s. So this is a area that has been well explored and well serviced for our students. In 1864 was the first college for hearing impaired, which today is Gallaudet University. Different types of communication that we'll be talking about in the course of hearing impairments include manual communication, which is sign language or finger spelling, oral communication, which is typically used or encouraged when students have some sort of residual hearing or they do some sort of lip reading. And then finally is total communication, which is a combination of both spoken and manual, whether that's finger spelling or sign language. So there's a combination of these different types of communication within the field of hearing impairment. Hearing impairments is one of the 13 federal categories under IDEA, but within the field there are other components within hearing impairments that really specify exactly what we're talking about with the students' abilities, disabilities, and the actual progression of hearing loss, or whether the student was actually born with the hearing loss. So hearing impairment has to do with some sort of disordered hearing. That could be almost anything. Hearing sensitivity loss is usually described in some sort of range, so you'll have mild loss or more profound, and this is something that could also change over time. So it could be degenerative hearing loss as well. That would go into that hearing sensitivity loss. Deaf or deafness, and this is the non-functional hearing, and the federal definition does require the educational impact of hearing loss. So when you start to differentiate between hearing impairments and deafness, there may be a discrepancy if there is no educational impact. So this can get kind of tricky, and we'll talk about deafness or deaf with a capital D in a little bit when we talk about culture, because sometimes students don't necessarily qualify just because they are deaf. Hard of hearing might be that residual hearing ability. So again, if a student had some sort of hearing loss and then they got cochlear implants, or they're still able to hear in one ear but not the other, that may be kind of the hard of hearing description. And last is minimal hearing loss, and this is very specific to distance or being able to drown out certain background noises or even pitches in sound. So the minimal hearing loss may just be specific to situational or types of noises. This gives you a visual of what the ear looks like, and you can come back to this when we talk about some of the different kinds of hearing loss. And also, this is important to note when we talk about cochlear implants, because you'll be able to see where the cochlear nerve is, and the tubes within the ears, the ear canal, so you can see all the different kind of parts of the ear in order to kind of make sense. There's something called sensory neural hearing loss, and that involves the inner ear sections, which is the cochlea, and as well as that auditory nerve. So depending on what the hearing loss is what is going to be impacted when you look at this particular diagram. You'll see this again if you look at the video on cochlear implants. I'm not going to go through all of these individually, but what's important to know with these classifications is that some hearing loss starts from birth and cannot be changed or improved upon with things like cochlear implants or hearing aids or amplification devices. So depending on the root of the cause, we will be able to make adjustments accordingly to devices or services that we're able to provide students. So again, when you go to that video of the cochlear implants, it's important to understand that not all types of hearing loss are going to be responsive to something like that and a tool like that. That's why we can't just kind of fix everyone who has hearing loss or maybe deaf. This gives you an idea of some of the prevalence of hearing impairments as well as the age of onset. At birth, if you look at 1,000 babies, 2 to 3 of those babies will have some detectable hearing loss. So while it's not hugely prevalent, it's probably more common than you would think. By the time that children are 12, 1 in 8 has some sort of hearing loss in one or both ears. So it becomes more common, obviously, as children and adults get older, which goes with the age of onset. So it could be prelingual, so babies who are born with hearing loss, or postlingual, and this could happen after speech has developed. And this is important to know because it really does change the communication style of the children, whether or not you're going to use sign language or students are going to continue reading lips or speaking. So the child has to have had some sort of language prior to the hearing loss in order to do the latter types of communication, which is, reading lips or actually verbally speaking. When talking about students with hearing impairments, this gives you a breakdown of the placement of those particular children, and you'll see that a little over half, 52%, receive their services or educational placements. Their least restrictive environment is the regular classroom. And then you can see there's more of a breakdown, and it's almost equally distributed between a separate class and a resource room. So the regular classroom are most likely students who don't need a lot of extra supports and are able to access the language within the classroom through amplifying devices, through cochlear implants, through hearing aids, or possibly their hearing loss isn't bad enough that they need an additional device. Once you get to kind of the yellow and the purple, those pullouts, we're talking about more severe hearing loss, where students need more specific or more intensive interventions or intensive supports. And then finally, you'll see the separate school residential facilities. And especially in the case of hearing impairments, students who are deaf may go to a school where all students are deaf so that they can be integrated and really brought into an entire culture of the deaf community. When talking about age of onset and some of the causes of hearing loss, it's also important to understand that there's certain disorders and disabilities that are associated with hearing loss in children. CMV, which is a viral infection, can cause hearing loss, and it occurs in 1 in 1,000 live births. So you're not looking at a huge number, but it is associated frequently with hearing loss. Down syndrome is another disability that is frequently attached to some sort of hearing loss. About 30% of the children with Down syndrome have some range of hearing loss. Meningitis is another. Usher syndrome is another that you may hear. But it's important to know that the hearing loss may be a manifestation of another disability that the student may have. Students with hearing impairments do not necessarily have a cognitive disability. If there is another disability attached to the hearing impairment, like we were just talking about Down syndrome, it may be the case that the student's cognitive ability is below what would be considered to be average. However, most of the time, the problem with the ability to access knowledge has to do more with language development than the cognitive ability. So frequently these students aren't exposed to language because they can't hear it, or they don't hear it well enough, or they don't get the opportunity to practice vocabulary, to practice sentence structure, to practice reading, to hear reading. So because of those things, the speech and language is often impacted. Another area that's really strongly impacted is the social development. And that again is because of the communication delays. If you can't hear how people are interacting, you're missing all those cues with language, your socialization is hindered. So what you will find is students who have hearing impairments may have some behavioral challenges, and that may be because they haven't had the exposure and the opportunities for practice that other students have had. And you'll also see that educationally they may be 3 to 4 years below grade level, because oftentimes we're teaching those students a language that the rest of their peers are not speaking, sign language, or doing some sort of finger spelling. So you'll see the educational delays, but don't think it's a reflection of the cognitive ability of those students. In order to do assessments for students who have hearing impairments, the first requirement is a cognitive assessment, just like we would do for any disability area. We need to see where the student is in relationship to their peers, in relationship to a scaled IQ performance. So we do a cognitive assessment, but we use nonverbal assessment measures so that we're getting a true picture of what the student is able to do and getting a true picture of what their aptitude is as well. There's also a speech assessment which will happen that has to do with articulation, pitch, loudness, quality, rate. A lot of that is about enunciation and pronunciation. And then oftentimes you'll also have a social behavioral assessment, which again ties back into the previous slide when we were talking about the fact that many students who have hearing impairments often have behavioral challenges, and that's because of the lack of ability to learn about socialization through language. When talking about sign language and the different ways that students with hearing impairments communicate, the most prevalent way of signing is the American Sign Language, and ASL is recognized in the United States as the way to communicate. If you watch any shows where there is some interpretation, they're using ASL. ASL is difficult at times, especially as it translates to writing, because ASL doesn't use a word-to-word interpretation. So ASL takes components of a sentence and puts it together, but doesn't necessarily include all the prepositions, all the connector words. So you're not going to have words like in or of or the. You're going to have the main words. And this is important to know, because if you have a student who has hearing impairments, you may see that reflected in their writing. So oftentimes the writing is very choppy and doesn't flow, because through ASL, you don't have those connector words. There's no need for those words, so it doesn't translate well to written word or written language. So that's an important component. Signing exact English is much like ASL, except that you have all those connector words. It's as if you were signing a sentence. And then signed English, again, brings it all together even more so and really refines it. But ASL is what you're commonly going to see when it comes to sign language systems. There are a number of other educational considerations when you're talking about communication, and one is this bilingual, bicultural component.